Well, I had just had back surgery. I could not get in my bed. I could not, I had trouble actually getting up and down out of a chair. I was sleeping in my recliner because I couldn't get in my bed. I had to have a walker to get out of my chair, and I had to have a walker to move around in my apartment. And of course, getting dressed was very, very difficult. So I was having trouble at first doing hardly anything. I had a spinal surgery with screws and rods and all that kind of stuff, so my lower lumbar area was in pretty bad pain, and I was having problem with any kind of range of motion. Well, to be able to get around, movement, to be able to do whatever I needed to do here in my apartment, and to get out and be able to go downstairs and go out and drive my car and, do things, and which I can now. Well, if they're like me, they do. Some people will do it on their own, but I knew I wouldn't. So yes, I need somebody to help me get going. Well, that y'all tend to analyze the problem, figure out what you need, and do what you need to do to help the problem. So, if somebody had a problem, they definitely need to seek some help, I would think. Well, all I can tell them is it's worked for me, so, I think they should try it, and usually, if they're my age now, Medicare pays for it. It doesn't cost anything to try, so it certainly wouldn't hurt to try and see if it would help, and I would imagine that it would. Well, so far, y'all have been very thorough and tried very hard to fix any, problems I had, any pain that I had, or figure out what the problem is, and I've been very happy with the therapists that I've had. Well, not really, just that I've been very happy with the progress I've made. I have a hard time even remembering that I couldn't get in my bed, and I never use my walker in the apartment anymore. I do use it when I leave the apartment, because I still have a problem with my back, that if I'm standing too long, I have a problem, so I have to sit down. And I've had 2 neurosurgeons and 3 pain specialists that couldn't figure that one out. So, I'm still having a little bit of a problem there. But I can do anything I need to do now, except for stand for long periods. So, the physical therapy's definitely gotten me from the shape I was in last fall to where I am now. And I've been out. Sarah had me out today. I've walked all the way around this floor of the atria, which is pretty good ways, and then done exercises along the way. And I'm in pretty good shape for the situation I was in earlier.